If you're dealing with pain in your arm and you're trying to figure out if it's coming from your neck or your shoulder, you're going to want to watch our next back and body video. Hi, Dr. Dave Perna here, your New York City chiropractor with Back and Body, offering our collaborative care approach of chiropractic, physical therapy, acupuncture, right here in Midtown Manhattan, New York City, as well as in Springfield, New Jersey. This is a great topic that covers the difference between a neck or a shoulder problem, and this is where our collaborative care approach really comes in handy. So, what if this is your situation? You're dealing with a problem that's in your arm, and you're not sure if it's coming from the shoulder or the neck, but you're pretty sure it's nerve. You're having some numbness, tingling, maybe some noted weakness in the arm. And you just can't figure out where it's coming from now. But first, let's just preface saying that we're not doing this to self-diagnose or self-treat. This is for informational purposes only, and if you want a true diagnosis, to seek the healthcare profession out for some proper advice. Okay, now that we got that out of the way, let's just say that if you're dealing with neck pain or a problem going into your arm, and we think it's from the neck, if your head is flexed forward, or if you notice increased discomfort when your head is turned or turned and looking up, and you feel pain going into the arm, it's more than likely from the neck. Okay? Now, if you have a pain in the arm or numbness or tingling in the arm, it's more noticeable when your hand is overhead, or if your hand is out to your side, it's a good chance it's from the shoulder directly. There is a nerve that comes out of the back of your shoulder that'll actually get stretched when you raise your arm up overhead. And we're going to show you a little bit of information on this right now. Okay guys, this is from Netter. So what we're looking at is the back of the shoulder. Here is that quadrangular space where a little nerve called the axillary nerve comes out. This can get trapped. The quadrangular space is bordered by the humerus on the outside, triceps on the inside, teres minor up top, teres major down below. And let's say the muscles of the teres minor muscle or teres major muscle are affected from too much throwing or controlling the motion of an overthrow. These muscles could get injured, swell, or develop adhesions in them, and that can cause problems of clamping down on that nerve, and that can cause nerve-like discomfort in the arm. Now, the interesting thing is, it can show more when the arm is overhead, and we're going to talk about that in a sec. All right, so we have Ann here, and we're looking at her shoulder from behind, and that space is right in here, and that nerve comes out right there. So if she were to raise her arm up, when she does that, the nerve, if it's compressed here, the rest of the nerve as it comes out of the arm is going to get stretched and pulled, and that's going to cause the nerve to light up from that. So what we're going to do for treatment in this is release these muscles to open up this space so that that nerve can come out and come in and out of that space freely without getting pulled on and irritated. All right, so we're back. So the basics that we just understood with the anatomy, the traction on that nerve that happens in the shoulder is actually, if it's coming from the neck, it's actually relieved when you put your hand over your head. So if you have nerve pain that gets better when your hand is over your head, it's more than likely coming from your neck. So that's a simple way to understand what's happening with your body. Now, we do in this office have a couple ways to work with this, and that's through the physical therapy, doing some work to release the muscles surrounding the nerve in the back of your shoulder. And let's say it's coming from the neck, the physical therapist can do some soft tissue work, medical massage, and what we call flossing, which gently tractions out the nerve and tries to release it from any adhesions in the neck. Then, of course, as chiropractors, we would gently work on manipulating the neck to help free it up so the nerve moves better through the spaces in the neck. Now, to properly diagnose this, though, we also have a medical doctor on staff, Dr. Savindra, and he can perform what's called an NCV-EMG. This will give us a precise diagnosis to tell us if it's compressed from the neck, which is called a radiculopathy, or if it's peripheral neuropathy coming from the shoulder. This test can give us also some specific ideas on how bad the nerve is currently doing from the problem. We can use this objectively along with some objective measures, some strength tests, pushing down in the arm, some grip strength tests, things like that to see how the nerve is doing. If you want further information on treatment for this, please visit our website, backandbodyny.com if you're in the New York City area, or if you're in New Jersey, backandbodynj.com. We'll see you soon.